Thanks for checking out this video. My name is Salil Upasani. I am a pediatric orthopedic surgeon at Rady Children's Hospital in San Diego, and I'll be talking to you today about low back pain in kids. So first off, I'd say that low back pain is actually extremely common. This one study reported that 70 to 80% of kids have low back pain before they turn 20 years of age. And kind of the traditional view of low back pain being an indicator of something really bad in kids has changed over the last couple decades. And now the more common causes of pain that we see include muscular spasms or imbalances, especially with tight hamstrings that lead to low back pain. Sometimes we see traumatic injuries like with sports or with falls that can cause fractures in the spine that result in back pain. There's also a condition called spondylolysis, which is a stress injury that kids can get with repetitive activities, especially things like gymnastics or when they're bending backwards, like with heavy weightlifting or playing football. Other common causes are disc-related, so the degenerative disc disease, which adults get, you can sometimes see in young, active, athletic adolescents, where they start getting a little bit of wear and tear in the disc, causing some pain. And then the more unusual or rare causes of pain include inflammatory syndromes, like an autoimmune condition that causes inflammation in the tissues of the spine, or deformities like scoliosis, which is a twist in the spine, or Sherman's kyphosis, which is increased curvature in the spine, looking at the spine from the side. Other things include infections or tumors, which are extremely rare in kids. So when we see a child with back pain in clinic, we start off by talking to the kid and his parents to see when the pain began, if there was an inciting event, like a traumatic episode that caused the pain, how long the pain has been there, when the pain presents itself, like is it bad first thing in the morning or is it bad after activities, how often they feel these symptoms, where exactly the pain is. It's very common for a child to walk into clinic and say that my entire back hurts, but by asking these questions and having them localize the pain, you can see whether it's between the shoulder blades, whether it's in the low back region, whether they actually feel it going down the legs. And then we look for things that they've done previously to either make the pain go away or some activities that make the pain worse. I'd say the most important symptoms of significance that we look for is constant pain or pain at night that wakes them up from sleeping, or something called constitutional symptoms, which is like fevers, chills, weight loss. Those are all indications of something more serious going on, like an infection or tumor. The most common symptoms we see are pain related with activities or sports, and this is usually resulting from muscle spasms or that stress injury or a spondylolysis that can happen in the low back. Some other things that we look for is morning pain, so pain that's worse first thing in the morning and starts getting better as the child begins the day, which can usually be connected with an autoimmune or inflammatory condition. And then radicular symptoms, which is pain that's radiating down the legs from the back down into the foot, which could be an indicator of a pinched nerve or disc degeneration. So we start off by seeing how the patient is standing, by looking at their posture, by seeing how they walk to see if there's any imbalance in their gait or any muscle weaknesses which change their gait patterns. We also evaluate their range of motion, so with them bending forward, bending backwards, bending to the sides, to see if there's any imbalances in how the spine moves. Then we focus on a very specific neurologic exam, so we look at how the muscles of the arms, of the legs are working, and we look at the reflexes. Some of the most common reflexes that we look at are at the knees or the ankles to make sure that that connection between the nerves and the muscles is working properly. And then there's some specific exam findings that we look for, such as hamstring tightness, to look for knee or hip flexion contractures. We also have the patient bending backwards to see if they have pain with extension, which can be connected with the stress injury in the low back. We also look for any suspicious neurologic findings, something called the abdominal reflex test, where we see how the belly button responds to stimulation with our reflex hammer. So once we're done with our exam, we get x-rays. That's kind of the first test that we do to evaluate the spine. We look at the spine from the front, we look at the spine from the side to see if there's any abnormalities in the way the spine is lined up, or if there's any bony injuries that could be connected with the pain. From the side view, one of the most common things that we see are those stress injuries or the spondylolysis, where there could be irritation of the bone at the very, very bottom part of the spine where it's connected to the pelvis. If the x-rays look good, sometimes we can get lab studies, so blood work to look for infections or to look for inflammatory conditions, or we look for metabolic issues in terms of how the kids are metabolizing calcium and vitamin D. We can also do advanced imaging studies such as an MRI or a CT scan. Those tests are usually ordered to look for very specific conditions. Like for an MRI, we'd be looking for a degenerative disc issue, or on a CT scan, we'd be looking for a stress fracture in the bottom portion of the spine. In terms of how we treat a lot of these conditions, most of the muscle-related pain, so either coming from muscle spasms or tight muscles in the legs, can be treated with either a good home exercise program or with physical therapy. Usually we educate the family on how the muscles can be causing the symptoms that the child is feeling, and then we really encourage them to have a focused exercise program to help alleviate the pain. Rarely we can use anti-inflammatory medications like ibuprofen or Advil to help with some of the inflammatory related pain that they're having. If there's a traumatic cause, so an injury that specifically causes the pain, we can treat the fracture. Most of these are treated with braces or with rest and activity modification, but sometimes they can require more serious interventions like surgery if there's an unstable injury to the spine. The spondylolysis or the stress injuries are usually treated with a period of immobilization or rest, so most commonly using a brace. We give about 6 weeks for the pain and stress injury to subside, and then we get them into formal physical therapy to help strengthen up the core and to strengthen the back muscles and improve the mobility of the spine before we let them return back to their sports about 3 months after the injury. In terms of the disc-related causes of pain, these are usually treated, again, with a good home exercise or physical therapy program where we're working on core strengthening to take pressure off of the disc and improve the mobility of the spine. Sometimes these kids will require either an oral steroid dose pack to treat the inflammation around the nerve roots, or even like an injection into the spine, specifically where the disc is irritating the nerve roots. In terms of inflammatory causes of back pain, such as with ankylosing spondylitis, which is an autoimmune condition which affects the tissues around the spine, or juvenile rheumatoid arthritis. These are usually treated by our rheumatology colleagues, and they use medicines to help slow down the inflammation or the autoimmune system. Back pain from deformity, again from things like scoliosis or from Sherman's kyphosis, usually is treated with bracing to control the shape of the spine, or can eventually need surgery if the shape of the spine is severe enough. Infections are often treated with antibiotics. This is usually given through the veins, or sometimes can be treated with oral antibiotics. Surgery is very rarely needed to treat infections in children. I hope that answers most of your questions about low back pain in kids. Again, it's very common. Most of the time it's caused by muscle imbalances, which can be treated properly with a good home program or with physical therapy. Thank you so much. Bye.